All righty. We should be recording. We're good. We're good. All right. Welcome everyone to today's webinar, our request for applications and info webinar on our upcoming learning collaborative opportunity focused on increasing immunizations through well-child visits for school-based health centers like yourself. We are going to go ahead and just jump right in, even as folks continue to, come in. And feel free, of course, to introduce yourself in the chat box. All right, as we come into Zoom, some reminders and etiquette. Thank you everybody for being on time today. If you're able to, please turn on your camera and be visible to speakers and participants, and remain muted as much as you can during the presentation and when others are speaking. We will have a time at the end for questions and answers. So if you can keep yourself muted until then and put your questions in the chat box. If they are urgent, that would be awesome. Overall, just enjoy yourself, relax, and we're excited to have you here. As you can see at the bottom of the screen, there's just a few different Zoom buttons to know about, such as our mute button on the bottom left, the camera button right next to that, our important chat box for you to enter any questions, information there, and finally at the end, you can press leave to end the call. So moving into our agenda, we have a quick agenda for today, so we'll be able to open it up to any questions specific to your context. We will be starting out with some introductions of our SBHA team. Then we'll move into an overview of the toolkit that is actually already created to help folks with increasing immunizations and well-child visits. So we'll be going over that. And then the bulk of our agenda today is going to be the Learning Collaborative overview. We're going to talk about participant benefits. We're going to talk about requirements and the whole timeline and process there. So you'll be having everything you need to know to apply as soon as we end today's session. And then lastly, like I said, we will be closing with some Q&A. All righty, so moving into introductions. I'm excited to introduce myself. My name is Michaela Riven. I use she, her pronouns. I am a program associate here at the School-Based Health Alliance, and I am so excited to introduce and turn it over to my wonderful colleague, Gone.
Thank you, Michaela. Good afternoon, everyone. My name is Gone Job. I am a program manager here at the School-Based Health Alliance. And let's go ahead and get right into the agenda. All right, so the School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health centers. Since 1995, the School-Based Health Alliance, a 501c3 nonprofit corporation, has supported and advocated for high-quality healthcare in schools for the nation's most vulnerable children. Working at the intersection of healthcare and education, the School-Based Health Alliance is a recognized leader in the field and a source for information on best practices for philanthropy, federal, state, and local partners and policymakers. Next slide. We believe that all children and adolescents deserve to thrive. Too many struggle because they lack equitable access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students typically spend the majority of their times in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick and expert attention, and we all know that healthy students make better learners. Next slide. All right, so previously we had done some work with Merck and created a toolkit that was developed to help educators, providers, and nurses to encourage them and enable them to help families catch up on immunizations and so this toolkit, it has information that provides some overview on some data related to how COVID impacted well-child visits and immunizations, as well as what health centers are. There are buckets in this toolkit that divides up different populations and provides resources for each of those populations. So there's a bucket For school partners, there's a bucket for providers, there's a bucket for nurses, and with those buckets, you can find information about partnerships, data sharing, and communication strategies. We also include best practices. There was some interviews from people from the field, and they include what best practices works for them and their recommendations for others in the field. We've also done a previous webinar detailing more on this toolkit, and we will have that in the chat box for you all to review. So from this work that we've previously done, we found that there is more to be done. We recognize that school-based health centers are vital to increasing immunizations and well-child visits in school-age children. So we are glad to announce our upcoming learning collaborative, which is supported through an independent educational grant through Merck.
All righty, awesome. Thank you so much, Gone. I'm going to take us into the actual learning collaborative overview and goals to get us into the bulk of what we're here for today. So what we will be doing is selecting actually 2 cohorts of 12 eligible school-based health centers to participate in a 4-session learning collaborative in addition to a welcome session that will be taking place between August and November. There will be different times for each cohort, which we'll go over shortly. And as you can guess, it is focused on increasing immunizations through well-child visits for school-aged youth. So each school-based health center will be focusing on fostering collaboration and networking opportunities with fellow participants and subject matter experts. We'll also be creating, this cohort of individuals, obviously, and you're going to be there for one another with peer support. And lastly, one of our big goals is to implement at least one strategy for intervention to practice and report back with a 90-day post-survey for that important evaluation component. All righty, moving forward to timeline and tasks. So there are a lot of dates and times here. I'm not going to go over every single one, but I'm just going to point to a few key ones. Obviously, we are at the RFA informational webinar today on the 14th. Our next big deadline is actually the application due date, which is a month from today on July 14th. So that will be a date to keep in mind so that you can get your applications in before then. And then from there, we will be notifying applicants pretty quickly on July 21st, and sending over the pre-survey along with that notification. And so the pre-survey is the pre-work, just to clarify. And that pre-work will be pretty quick survey. That's 5 to 10 minutes that will be due a week after being notified. Then below, you can see there are different cohort dates. We have the first cohort starting in early August and ending mid-October, and the second cohort starting at August 30th and ending November 15th. We will be allowing folks to choose their preference for your cohort date in the RFA application, which Gone will go over in just a little bit as well. So this is the general timeline and tasks for our upcoming learning community. All right, I'll turn it over to Gone on who should apply.
All right, so who are we looking to apply? We are looking for school-based health centers with a strong interest in increasing or improving their well-child and immunization practices in school-age youth. We want people who are motivated to be a part of this work because it is a learning collaborative for people to come together and learn together. Applicant requirements. So like I said, we're looking for those who work in a school-based health center with that strong interest. We require that you submit a completed application, which we will share shortly, as well as identifying a few school-based staff champions to participate with you.
All righty, so as far as participant requirements, so again, as we discussed, we're going to have you complete the pre-survey once selected, which will be due the 28th. You will be notified if you have been selected on the 21st and have 1 week from that time to complete this short survey. Similarly, we're going to ask all folks participating to commit to attending all virtual learning sessions and actively engage throughout. Along with that, we do require and expect folks to maintain that open and willingness for safe spaces and support one another in all the sessions. Again, around the actual participation with the learning community, we will be asking every group to present on your progress, success, challenges, etc., at least once throughout our learning sessions. And lastly, we will be utilizing Zoom for the learning sessions themselves and something called Basecamp that we'll be using in between the sessions for discussion, details, resources, etc. So benefits, all the good stuff. Let's talk about that. So you will be able to apply for 6 continuing education units that will be available for multiple disciplines. Similarly, that good networking and peer-to-peer learning with participants and subject matter experts in the school-based healthcare field. We'll have 4 virtual learning sessions in addition to the first welcome session. And then we'll be providing you tons of resources to develop and improve key partnerships in the school setting, opportunities for feedback and collaborative problem solving, both in the actual learning sessions and outside of, and access to virtual convenience on Zoom and Basecamp, as I shared previously.
All right, so the online application, what is it that we're asking you to fill out? Really, we want to get to know you. So we're asking for your name, contact information, your SVHC, and then there's going to be some short questions where we just want to get to know you a bit more. So tell us about your challenges, tell us about your motivations and interests, and what it is that you're wanting to learn from this learning collaborative. Additionally, there is a question asking if you have a preference for which cohort. As Michaela mentioned, we have 2 cohort dates, one running from August through October and another running from September to November. So we understand that those the back to school period is a busy time for many SVHCs. So we will do our best to accommodate you if you choose one cohort over the other. But at the same time, understand that we may not be able to accommodate everyone. So I am sharing that application now. So if you have any questions, feel free to ask.
I have a question. I'm sorry about the application.
Yes.
Okay. And I'm sorry if it looks weird. I'm on my phone. With the school-based health centers that I'm affiliated with, I'm from Akron Children's Hospital. It asked for the address of them, but I have multiple because we're kind of a mobile school-based health center. Do I just put in there, multiple school-based health centers throughout our school districts, or do you want me just to list like my main my office, but it's through Akron Children's Hospital. So I have we cover 12, basically I have 12 plus school-based health centers in our districts. So I guess I just didn't know how you wanted me to fill that in. Sorry, if that makes sense.
Yes, so I just want to clarify on that. Is it 12 separate school-based health centers, or is
Yes.
it a mobile that travels to different locations?
No, our model is very unique in which our nurse practitioners go to the school. So it would be 12 separate. I don't have a mobile van or anything like that.
Okay. Go ahead and put your main address.
Okay.
And if anything else we need to clarify, we will reach out to you via email.
Fantastic. Thank you so much.
Thank you for your question. All right, Michaela, go ahead and continue with.
All right, before I bring us to our main Q&A time, I'm just going to quickly share with everyone our really exciting upcoming national conference for the School-Based Health Alliance that will be taking place very shortly, June 26th to 28th. You still do have time to register. Goni will be putting in the registration link, so please do join us if you're able to. It is going to be a wonderful time in Washington, D.C. And now we will bring it to our question and answering. So if you do have any lingering questions, thoughts, context specific, now is your time. We'd love to answer them and are here as a resource for you.
Looks like we have a question in the chat. If we operate multiple separate SVHCs, is the application for one site or staff, or would it be for different or multiple SPHCs? So to answer that question, it would be one application for each SPHC that is wanting to join. So if you have multiple staff at each of the SPHCs and each of those staff want to join on this learning collaborative, we ask that you do multiple applications for each of those sites. However, if you have one staff member or a few staff members that rotate throughout those SPHCs, then we would ask that you do one application with that staff member that will be joining. I hope that answers your question. So the number of team members we would like to participate, I'd say at least 2, maximum 4. So one main contact and at least one other person to participate with them, and a maximum of 3 other people to participate with them. All right, Denise, we will drop the application back into the chat for you. Let us know if you have any questions since you joined a bit late. All right, so another question, can one of the participants be a collaborator that is a school employee that works closely with the school-based health staff? I say if you have a school employee that works closely with you and they are a champion or wanting to be a champion for this work, then they can be a participant as well. But we do ask that the main person be with the school-based health center. All right, keep them coming, Lisa. No problem at all.
We definitely encourage the questions, and so feel free to keep asking questions. And if something comes up later too, or when you have time to actually submit the application and you're like, wow, I have this new question that popped up, do feel free to reach out to us. Our emails that are listed here. We'd love to answer your questions, and are really excited for this learning collaborative.
All right, so we'll give it about 2 more minutes. If there's any more questions, we'll give you guys about 2 more minutes to ask. Otherwise, we will wrap up here shortly.
We did say it was a quick agenda, so we gave ourselves 4 to 5 just in case, but
Go ahead with your question, Denise. Feel free to come off mute as well.
Okay, it's okay to ask it?
Yes, go
Okay,
ahead.
okay. I'm so sorry I jumped on so late. So this has to be due in July, and it's so for instance, I think like the other person that was on before, I'm sorry I didn't know your name, was talking that she has 11 sites. I basically do the same thing that you do in 2 different districts with 12 sites. So I have to do 12 different applications and specify the 2 different districts I work with within New Jersey, correct?
Yeah, do you have different staff at each of those sites that will be wanting to join?
I have each of my sites are staffed.
Each of your, yeah, so I would say for each site, that want to be a part of this collaborative, have them do a separate application. And if you could just know that you're all under the same organization, that would be helpful for us as well.
Okay, thank you.
Just to add on to that, Denise, hi, I'm Addie Evanswell. I'm a senior program manager with the School-Based Health Alliance. I would say that if you have that many sites, it might be good to really kind of take a look internally where you think or what site you think would benefit the most from participation, because they can really then share those lessons learned to their coworkers, because we do have a limit per cohort. So
Right.
if all 12 of your sites apply, that might be really difficult for us to kind of determine who we're going to accept, who we're not going to accept. So if you can at least narrow that down a little bit before you submit the applications, that would at least help us a little
Right.
bit, because it would be really overwhelming to have for you
I
too.
know. I was
Exactly.
actually thinking I have an operations manager that would probably be the person for one district and one person for another. So
Okay. Yeah, no,
Yeah.
that makes much
Yeah.
more sense. But I just
Yeah.
wanted to throw that in there as well.
yeah,
Just
thank you.
something to consider.
If you
So I'll
want-
just put her name on all the applications, basically, the two people as contact.
And since you work with two different districts, if maybe you wanted to choose one school-based health center that works with each of those and some staff that are motivated to do this work, that could be an option as well, so that you don't
Mhm,
have
mhm.
to do that many applications. So see what works best for your organization.
Okay, perfect. Thank you.
All right, any other questions? All righty, well, we'll go ahead and wrap up. Thank you everyone for joining us today. Michaela, did you want to share more about our conference one more time?
Sure, absolutely. Just for folks coming in at the end, or a quick reminder, we have our upcoming conference at the end of June. So just a short few weeks away, June 26th through the 28th in Washington, DC. We'll go ahead and put the conference registration link back in the chat for folks who are interested. And it's going to be a really great conference with school-based health center, and school-based healthcare folks from all over the country coming to participate. So we're really excited, and hopefully we'll be able to see some of you there.
All right, and if you have any other questions that have come up, feel free to send us an email. If you have any other questions pertaining to the application, don't hesitate to reach out. Thank you all for your time.
Thank you, everybody.
Thank you.